Welcome to the Immune Edit. I'm Dr. Doug Jones. If your immune system feels like the enemy or you're just tired of not feeling like yourself, this space is for you. Thank you for joining today, and I'm so excited to have you on as a guest. It's been an honor to get to know you over the last few years. And so why don't you just introduce yourself to the community, to the audience listening, and let's kick it off from there.
Okay, I'm honored to be here. I'm honored to know you likewise. And so I am Manisha Relan. I am a board certified pediatric allergist. And so, as you know, in our training, we cross train. So I see all ages. I'm in private practice. I have a very academic mindset. I like to stay on top of all of the stuff. And I find that I am most drawn to the fact that there's a lot of gaps in our knowledge and in the community and the practicing of the community. And so that is what led me into the social media space, which is, I think, how we met really and
Yeah,
connected.
it
Um,
is.
so, yeah, I've been there for a long time. You've been there for a long time. And it's really ironic that we didn't connect until the social media committee.
I
And
know.
then I was like, who is Dr. Jones?
I know. That's the same. It's like, wow, here we are.
Yeah.
It's been awesome to see how social media has actually connected me with various people that,
Mhm.
we've probably passed in the halls at various meetings over the years and don't, in certain aspects, it's like you have people, your former colleagues that that you kind of hang out with, and this has expanded that network and allowed me to meet some really wonderful people that I probably rubbed shoulders with, just never had that opportunity. And you're one of those where it's like awesome to get to know and really love your work on your platform. You have such one of the things I'm most impressed with is the engagement of your community and like the quality of that engagement with the community.
Hmm.
And I think that's a reflection on you and
Thank you.
the quality content you put out and also, just that vibe that you kind of put out to the world. So it's
Mm.
amazing.
Thank you.
Yeah.
My vibe
Where,
is calm and informed. Like that's what
yeah.
I want everyone to be like when they come to me. Go ahead. You
How
were
do
going
you,
to say a question. Yeah.
I was going to follow up with that. How do
Yeah.
you maintain that calmness while being informed? Because I think a majority of the world, as they're trying to get information, allows it to really disrupt and disturb their
Mhm.
calmness. So what grounds you in that?
I think just looking at the facts and just asking myself, why am I stressed? Like, what can I control? What can I take away from this? And at what point is noise just noise and just really loud noise that I need to like tune down, like the volume of? So whether we speak the same language or don't, right? Like, because we can reach international audience, the matter is there's one true overall prevailing theme, which is like love. You care about
Yeah,
your child. That is
yeah,
why you found me. You started from a place of like, my child is facing this really scary diagnosis that could affect their quality and safety of life, and
hmm,
so it starts with love and it should like really come back to that. So anything that like distracts you and takes you away and makes you just like spiral into something more, we have to pause and say, what are the facts? What are we
yeah.
actually looking at?
Wow, that's beautiful. I love how you just start with love, and that's kind of the overarching thing.
Mhm.
Similarly, like years ago, I'm going to diverge just for a minute, but
Mhm.
years ago, I went through a lot of therapy. Actually, did something called EMDR.
Mhm.
Did a lot of work on me because I needed a ton of work. And one of the things was because of different experiences in my life, it was almost
Mhm.
like I was in a free fall.
Mhm.
And is how my therapist described it. And she said, we've got to find that one thing that you can hold to no matter what.
Hmm.
And so we went down multiple avenues of, when times were tough, when things were difficult, back up against the wall, or all the things like, what is the one thing that kind of helped me pivot and drive through that? And for me, and I think everyone has a one thing, but for
Hmm.
me, what we found was compassion. So
Oh,
very similar to love, it was
yeah,
actually compassion.
that's beautiful.
And whenever I feel stressed, whenever I feel maybe an angst or a disagreement, and I might feel like myself starting to uh, get too far in maybe the wrong direction, I just stop and I'll say, what does compassion lead me to, and where
Mhm.
do we go with compassion? I think that's very similar to
Yeah,
your journey and what you do with love,
yeah.
right? Uh,
Life is short. Like
right.
life is really, really short. What are we but a time speck, in this big
Yeah.
continuum?
Yeah.
And to live your life full of anxiety or to live your life full of not understanding something, that's I don't like that. If I can change
Yeah.
one person's understanding and acceptance of their diagnosis and say, all right, you are right. We do have to avoid this food, but do we really? Now we're going to talk about treatments. Like there's a
Yeah.
lot, there's a lot to unpack in that. That options that we all have nowadays that we didn't have like 10 years ago, 20 years ago.
Right. Right. Yeah. That's amazing. So you're practicing
Mhm.
in, let the audience know where you're located.
Yep, I'm in the capital region of New York State.
Great.
Yeah.
And how long have you been there?
I am about to close in on my 12th year here.
Great. Great.
Yeah, long time.
And in your region, this is so kind of region specific, and there's various challenges. What's kind of the thing that's most prevailing right now in terms of challenges, either for you as a doctor trying to give care, or perhaps challenges that you see from your patients?
Yeah, I think the biggest is access to care. And it's just summary of that is basically we have this amazing therapy, food immunotherapy, and it's hard to bring that to a community where it is just there's so much to break down and take apart. But like working in with other practitioners, or whether it be with staffing, because not being able to conduct oral food challenges in a timely manner, where like I just want to do like what you're just doing in the middle of one presently as we speak, but I just want to kind of hit the ground running with my thoughts and my ideas and my plans, and then it's just like, oh, there's a scheduling roadblock, oh, there's a availability roadblock. And part of it is self-inflicted because we're all humans. Like part of it is like we're busy, and how much capacity do we all have? And the other part is a system failure. Like we don't have enough providers to meet the capacity.
Yeah. Yeah. And we see that quite a bit. And I think some of the shortages are going to just increase. Um, where I was talking to an executive actually from a pretty large healthcare system, and one of their biggest concerns is actually they're losing, you know, a certain percentage of their workforce first to retirement, but
Mhm.
then so many are just burnt out from medicine. They're finding alternative careers, and their biggest concern was, or one of their biggest concerns was just, how are we going to deal with the shortages and the access? And so I think some of those challenges will continue,
Mhm.
um, unfortunately. But I think each of us in our own sphere want to be able to make that impact, and just continue to do the best we can in our sphere of influence to reach those around us, but also realize there's things much bigger than us.
Mhm.
And it's exciting when you can be a part of something bigger than you and us. And
Mhm.
I know one of my passions with that has been the food allergy community
Yeah.
in really trying to have outreach and get to those groups. I kind of have parallel communities as well, with kind of complex neuroimmune cases, where I actually treat a lot of patients suffering from various entities and haven't had that voice. And it's like what I try to do is just have that voice for them and make the impact where we can. But I've noticed one of the ways that I think that I'm so impressed with you that you have made an impact
Oh boy.
beyond your sphere
Yeah.
is a book.
Oh, yes. Yes,
Yes.
indeed. Yes, I have
And
written and co-authored books. Thank you. That is something that social media has brought to me, besides meeting you and some lovely co-colleagues, the community that follows us. I wanted to say before I jump it back into the book, I just wanted to say that the impact that you create is like so powerful. The impact to the food allergy community is so empowering, and talk about quality of life, right? Like those are the things that really ease someone's burden for day to day. Every How many times do we eat in a day? Like talk about that part. But yeah, talking about eating. So the book and the series of things. So I'm part of a team for solid food introduction to infants. It's 101 before one, and then we co-authored a book by the with the AAP, the American Academy of Pediatrics, all about how to introduce solid foods to your babies. And it's one of my, like, I love it. As you can see my smile on my face.
yeah,
It is like a true book of passion. It is everything I want every parent to know before they even have to come meet me, so they don't have to meet me. Like that's my goal. Here is read the chapter on allergy so that you
right.
never have to meet the allergist, because
Yeah.
the more you know, the better, the better you'll feel, the better you'll be able to intervene. And it's not a fail safe plan. Early introduction of allergens is not 100% effective. And for that, my heart does hurt. There's a lot of amazing things happening with Australia, and recognizing, right, doing the early introduction and then recognizing it and then going right into a treatment pathway, which I think is so cool.
Hmm.
Um, and with basically oral immunotherapy as a way. So I think it kind of comes back to you, like, talking about burnout. I'm feeling it. I'm
Yeah.
feeling it. It's a lot of pressure. It's a lot of things to juggle. I'm a human being. I have family. I have to look at my career, and I want to make an impact. And it's like, how do you balance all of the ends of things, plus being a human and having my own health journey to follow? Um,
Yeah.
do you feel like leaving the insurance landscape is a cure for burnout? Like, do you think that that's like one of the reasons that many providers are leaving medicine?
I don't know if it's a cure, but I think in a lot of cases, and I've talked to a lot of allergists, and I appreciate the question because I was just at a regional conference, the Western Society of Allergy, Asthma, and
Oh, you went.
Immunology.
Uh-huh.
Yeah. So I was just there and was able to rub shoulders with a lot of our colleagues.
Hmm.
And I think first, so many are leaving insurance as a survival mechanism, uh, not only due to burnout, but financial survival mechanism, because what insurance has done, and this isn't just me, but this is like me rubbing shoulders with many, many allergists across the country. Um, it's at a true breaking point in terms of the reimbursement that's gone down so low, yet the amount of overhead and cost that's gone so high. So the cost of even to test patients or to treat patients, the cost of that to certain practices is so high, but yet the reimbursement's so low, they're not able to survive. And then you couple that with the huge, just exponential growth numbers of prior authorizations and
Yeah.
denials that we have to deal with
Hmm.
that's uncompensated,
Hmm.
and you're having to pay the staff, and staff wages increase with inflation, yet reimbursement to practices does not.
Hmm.
And I don't think that's accounted for a lot. And so I'm talking to so many doctors that would prefer staying, offering insurance and offering all the access. They just can't. They literally are having to make some really difficult decisions in terms of how do we survive? How do we navigate this? I mean, I talked to a doc, pulled me aside. I will not disclose who it was, but
Mhm.
he was a very well established, well seasoned, well known, well versed physician who has multiple offices, close to 50 employees. And he literally pulled me aside and he said, I don't know how to do this anymore
Mm,
because we are struggling, from every aspect. And so I think in some cases, that's probably a longer answer than what it needed to be. But I
mm,
think in a lot of cases, so many are doing this just out of sheer survival
yeah.
first,
Mm,
um, to try and continue to serve the patients in any way that they can.
mhm,
Insurance is, doctors traditionally over the years have just given in. It's like,
mhm,
and so you have the insurance companies that will continue to move the goalposts, continue to make life worse for patients, for doctors. And the problem is the solution to that has always just been doctors need to do more with less.
mhm,
But that doesn't actually address the problem.
yeah.
All that does is lead to more burnout, and all it does is lead to more practices actually struggling to keep the doors open.
Yeah.
Because the problem it lies with insurance being unregulated,
Mhm,
insurance now making medical decisions,
mhm,
insurance requiring, these unruly and ungodly amount of prior authorizations
mhm,
that and continuing to dwindle the reimbursement. It's like that ultimately, when you look at healthcare, it's like the problem lies there, but the solutions aren't addressing that problem. The solutions are always doctors do more with less.
yeah. It's so
It's all
true.
it's always what we've been told: do more with less.
Honestly, in the almost 11 years that I've been here, that's an accurate reflection of exactly what I've experienced is my own personal salary has gone down
Yep.
like over the 5 to 10 years. And I do a lot of paperwork and my nurses help me with a lot of prior authorizations. It's just standard inhalers. Like it's not even like a leap, like an
Right.
actual big intervention that needs to take place that actually would require some thinking or but you're the specialist. So if you're asking for something, it's because I want
Yeah.
it
Yeah.
or I recommend it, and yeah. So
Right.
I write that a lot in my note. Insurance is
Same.
making medical decisions for me, or I am
Same.
being
I
restricted from.
I do as well. And
Yeah.
I'll say, if there's, some kind of harm or bad outcome to this patient, insurance needs to be held accountable to it,
Hmm.
because they made this decision, we didn't. Um, and it's unfortunate. Um, but anyway, it's a depressing
Yeah.
topic.
Sidetrack.
but
We
but it's the
we could make
reality.
a podcast on this.
It's the reality though of what we live in.
Yeah.
And we also, I take care of a lot of really complex patients. They don't fit the system. These patients come in with hundreds of pages of medical records, for me to review. They
Mhm.
come in with small fiber neuropathy, autonomic dysfunction, mast cell disorders, allergies,
Mhm.
GI issues,
Mhm.
and nobody can take care of them because our system is fragmented and nobody has time
Mhm.
because our system doesn't reward any of that. And
Correct.
if a doc is to take care of that population, they will go bankrupt. Like that practice will go under.
Yeah.
Um, and so it is hard because we have this very, very complex growing number of patients that's in a system currently that doesn't support caring for them. It's also in a system that doesn't support prevention.
Mhm.
Um, and then in my world, we spend an enormous amount of time overcoming the misinformation that patients are coming in with because what is getting rewarded in the world are influencers who don't have a medical license,
Mm-hmm.
influencers who are recommending tests or supplements that don't have the oversight from the FDA.
Mm-hmm.
So those products don't have to go through the rigorous clinical studies.
Yep.
And a lot of these influencers, because they're not doctors or licensed professionals,
Nothing to lose.
they can,
Nothing
I
to
always
lose.
say they can, the one thing sells, the one thing
Yeah.
scales, but that one thing often will fail
Yeah.
because they're oversimplifying life
Yeah.
down to the one thing.
Yeah.
When you oversimplify down to the one thing, what's lost?
All the
Nuance.
details. Yeah. All the
All the
details.
details and nuance
Yeah.
is lost.
Yeah. Yeah.
But that surely sells and that surely scales because, wow, they have that confidence within them because
Mm-hmm.
they are going to hook you. They are going to tell their story and emotionally connect with you. And then they have that call to action close
Mm-hmm.
and they have that online. And, a lot of the products that are being recommended because they have the word natural or organic or whatever on them are selling,
Yeah.
but they have not gone through the rigor of, say, a pharmaceutical product, and those people often don't even have to say much. We are more restricted in what we can and can't say
Mm-hmm. Mm-hmm.
because of our licensing.
Yeah. But at the
They're
same
not.
time, we have to be there. Like if we don't show up to help
Yeah.
counteract some of that, like just over the weekend, I spent time with Farah doing a post against Benadryl because someone with 1 million followers said that you should use Benadryl to treat anaphylaxis. And anaphylaxis is
Yeah.
like a passion area of mine. I'm like, this isn't how it works. This isn't the treatment of
Right.
choice. This is a like just understanding you're perpetuating a myth that
Hmm.
then how does a parent with a child that has food allergy explain to their neighbor that saw this video? And it's like, well, but Benadryl's fine. That's
Yes.
okay. Let them have their treat. It's fine. It
Yes.
isn't how it works.
No, no. I'm glad you did that post. What's crazy is last year, because you know me, I'm pretty outspoken on Benadryl. Um,
We all are, I
and
think.
I had a mom call me and she said she was at a youth camp as kind of a worker, and one of the kids was going into anaphylaxis,
Mm.
and everyone was telling her to use Benadryl. And she's like, Dr. Jones, your voice was in my head though. Don't use Benadryl, use Epi. So
I
she's like,
love it.
your voice on this was in my head. I'm like,
If
yeah,
only your
I'm
voice would
punking
be in
you.
everyone's head.
I'm going to hunt you. The Benadryl. um, but they gave Epi. And,
That's
they
amazing.
had 45 minutes to get to any kind of medical facility because they were out at a camp.
Sure. Yeah.
And I said, honestly, you probably saved that kid's life.
Amazing. I mean, but
Probably
this
saved it.
speaks to so many things. Like, we don't have time in our visit to go over an action plan, which we should be doing every single visit. We should be
Hmm.
going over when to use Epi, how to use Epi. Let's go over the plan. Let's go over the updated guidelines of anaphylaxis from 2023. And yet, I don't have that much time in my visit. I just
Right.
asked, oh, do you know when to use it? Do you know how to use it? If your answer is yes, sometimes I don't follow up because I'm like, I got other diagnoses to go over, and
Yeah.
it's like, where do you balance that? And sometimes I'm like, please just follow me and just see all the things online because this is like an ongoing conversation and there's so many little pieces that have to be addressed correctly to inform somebody fully of this very
Yeah.
important diagnosis.
I like what you really just said there. It's not just a one conversation, it's an ongoing conversation
Mhm.
that we need to have. And I think platforms like yours, where you're constantly educating, constantly giving great evidence based medicine out there, the book that you've done, all of those things are tremendous resources for patients to be able to have that ongoing conversation.
Mhm.
And I think voices like yours in this space are so important because, as we mentioned before, we're in a system that doesn't allow us to have those conversations. And
Yeah.
so we have to do more with less. So we go
Oh,
online. This is a way of us doing more with less so that we can have those ongoing conversations.
I mean, it's so, so important. This is, I mean, how often do you meet somebody, they share a life story or details of events, you forget, right? Like if I
Right.
taught you something like, and I only taught you once a year, how do I expect you to remember how to do something unless you tie your shoelace every single day, and you get that ingrained over and over?
Yeah.
It's can't keep
What
going.
are what
Yeah,
are the maybe one or two top conversations that you wish you could have? So epinephrine emergency plans are one of those. What are
definitely.
those top conversations that you wish you could have with your patients they actually had time to have,
Mm,
but perhaps you're educating on in different
yeah.
ways?
Well, sometimes I just make the time, and unfortunately, I get behind. But one of my other big passions is food allergy treatment options, because
Hmm.
I am not a just avoid, see you in a year kind of girl. I am
Yeah.
more like, let's sit down for a minute. I'm like, and I usually ask the parent, I'm like, is this a good time? Like, we're going to go into like a lot of information. Are you ready to receive this? Because
Yeah.
sometimes if they have other appointments, if they're distracted, maybe there's lots of little kids in the room. I sometimes ask if there's a second caregiver. I'm like, can you take some of the kids outside so I can talk one on one with a caregiver? Because this is a very important but like good 10 to 15 minute talk about what is all out there.
Hmm.
Where do you get access to it? What are the pros and cons? And it's really a amazing conversation to have because it's very nuanced and depends on like what the family's goals and desires are. It's also amazing in the sense that what you think you would want is not always what someone else wants. And so it's like the opposite of the golden rule, right? Because the golden rule is treat everybody like family or like you the way you would want to be treated, basically, which is how I always used to practice. And then I learned you have to treat other people the way they want to be treated. So now I've been like taking a step back, still coming from that space of treating them like family, but also asking, what are you ready for? Like, if you aren't ready, if this isn't bothering you, if you're not interested in ingesting this food, I'm not going to go over everything. I'll briefly mention, hey, there's some things out there. Hey, you want to talk about this or look this one up? We could talk about it in 6 months or something. But it's been an interesting flow. But yeah, if I had more time, I would just talk more about the options, and I would want to actually follow up and offer those options.
Sure.
And that is definitely a thing that I'm feeling restricted on. Going back to an earlier topic that we were talking about, just having come out of practice and not been taught this amazing thing, oral immunotherapy and sublingual immunotherapy to the audience listening, but just like it wasn't in my fellowship, right? I didn't
So
train.
when did yeah, this is an interesting thing. When did you
Yeah.
finish your training?
2014.
Oh, okay.
Yeah.
So back in about 2018 or 2019,
Uh-huh.
I sent an email to all the allergy training fellowship program directors
Hmm.
and offered a scholarship opportunity to attend, our conferences that we do for food allergy training. And I got zero responses.
It's incredible.
Zero.
Incredible.
Yeah,
That's great. They must all be experts, right?
I guess so, even though it's not in their curriculum. But yeah,
Well, but in the defense of my amazing program director, she does. She
she does
sends,
now.
she does now. I don't know when it
Yeah,
started. Very
I
fair.
know.
But I have to say that that is something that all doctors have to do, which is continuing medical education.
Hmm.
And it has to come from within. It takes time, it takes money. And guess what? We don't have either one of those in our
Right,
schedule. We don't have the guarantee
right.
that you will be given the opportunity to keep up. It's like such an internal switch
Hmm.
that has to be there.
Yeah,
Um, And that is like one of the biggest challenges of practicing in private medicine or private practice medicine is that you're kind of more isolated. So I don't go to grand rounds. I don't hear journal clubs. I don't hear the people at the table that are quote unquote making all the decisions. I don't hear those conversations, which is really important.
Right.
But I think that you can still find your way to those tables and to those opportunities as long as it's like in you to keep moving and keep
Hmm.
learning.
What are the top maybe two or three most common mistakes you see people make in the world of food allergy?
Oh, are you ready for this one? Okay, asking ChatGPT who hallucinates and will not give you the correct answer, right? Don't Google, don't ChatGPT your symptoms. Obviously, using Benadryl or an antihistamine, thinking that, hey, I am just going to sit and watch. I mean, antihistamines are great. They're a wonderful medication. I'm so happy that they exist. They're very helpful in managing skin symptoms, maybe some mild itching and hives and swelling. But what do they do for your respiratory tract, sir? What do they do for your GI system, your cardiovascular system? You know, there's only one medication for anaphylaxis. So that's probably the two and three is using the antihistamine, and then third is not using epinephrine early enough. I I've been hearing some chatter and about instead of saying mild symptoms and mild allergic reactions, calling it early anaphylaxis, and then calling anaphylaxis like true delayed anaphylaxis. So recognizing the symptoms of an early allergic response so you can treat it while it's still mild. And I thought that was really an interesting way to reframe what we witness.
Yeah, that is. We we've been working on a reframing of in terms of epinephrine, where people would say, "Oh, you use epi and then go to the ER." I often say
Mhm.
use epi to prevent the ER.
Yeah,
Um,
I
you
like
know,
that.
yeah,
Yeah,
and
it's
same kind of along the realm of what you're saying is we need
yeah,
to kind of reframe how we're thinking about some of those early symptoms. If it's not mild, it's no, this is early. This
hmm
is an early anaphylaxis. So what do we do for early anaphylaxis? We treat that
yeah,
early,
yeah,
right? With epi. Why? To prevent an
yeah.
ER event.
Yeah, don't go
So
to the pharmacy. Don't consult Benadryl. Like, do not stop and go. Like, go immediately to an
don't mimic
emergency.
the movie Hitch.
Don't do that.
They did
No.
everything wrong in that
Yes,
situation.
absolutely,
Yeah.
absolutely, absolutely. What are you
Yeah.
thinking about all the new devices of epinephrine? That's kind of an exciting, like, thing about our field is that there's been so much growth and so many new, I guess, tools in our toolbox and accessibility things like just having multiple options.
Yeah, I think having a menu available is nice,
Hmm.
for really anything that we do, because different things work for different people, in different
Exactly.
ways,
Yes.
and it'll be interesting to see what kind of studies come out, from all the new devices and what's going to be required of them moving forward, and does the kind of pre-approval data kind of pan out in real world
Hmm.
experience, because
Hmm.
as you know, a lot of times those two things don't align,
Yeah.
and when you're talking about a life-saving treatment, it's important you get that right. And
Yes.
so I think as we do get more devices, as we do get more options, we also just have to be really mindful of use proceeding with caution, with cautious optimism, I
Yeah.
guess, is
Yeah.
making sure it's for the right people. But yeah, it's exciting.
I always say it's awful to choose a disease off of the menu, but it's really exciting to choose a treatment off the menu.
It is. That's awesome. I'm just excited we have a menu.
Yeah.
So yeah,
Yeah. For long,
that's
it
good.
was just avoidance, right? It was just avoidance for so, so, so long.
Yes, for way too long.
Yeah.
Thankfully, we're this far into it with a lot of treatment options, with a lot of things. But as more options become available, then it's also an
Mhm.
opportunity for more kind of misinformation to surround that. And again, more important that there's a lot of voices out there that are helping patients navigate this making sure there's great information because search engines do hallucinate.
Mhm.
Um, Sometimes docs hallucinate.
Yep. Uh-huh. I mean, I'm gonna scratch my head on this one, but not all doctors were created equal. That's
No.
correct.
So we
As
want to
long
keep the
as long as the
hallucinations
patient
to the
isn't.
minimum.
Yes, absolutely.
Yeah,
Exactly that.
yeah. What else do you want to talk about today? Is there any burning questions, burning topics?
Um, let's see. We hit anaphylaxis. We hit infant feeding. I think the biggest thing about infant feeding for anyone that's still listening to this awesome conversation is that really truly I still meet so much hesitancy. I'm still, when I see my infants, I'm still seeing 8 9 month olds that haven't been introduced to nuts yet because there's so much fear.
Yeah.
I've been asked a couple of times by parents if they could be prescribed an epinephrine autoinjector before they introduce solid foods, just for
Hmm.
their peace of mind. And I think it's really important to get this out there that the risk of infant anaphylaxis is really, really rare.
Yeah.
And like that we've been feeding babies for so long. And again, it comes back to like how we started our conversation with compassion and with love and saying, look, you can do this. You really can. There's so many amazing resources out there that don't require you to have this epinephrine device sitting on your counter. Like, will that make you more anxious or less anxious? Like,
Yeah.
um, and at what point, because it may not be the first feed, it might be the third time you introduce the allergen. So you might think, oh, I'm out of the woods, I'm okay. But like you always have to kind of be aware of the child and the surroundings. That doesn't negate that, right? It doesn't take
Right.
that away. It's more about just empowering you to always just know what to look for and how to react and when to
Mhm.
call.
Yeah. There's an emerging topic on this that
Hmm.
I'm very much interested in. Um, First, to your point, it's taken so long to reverse the mindset of, when to feed, how to feed. I mean, the study was published in 2015.
Like crazy.
It's 11 years old now.
Yeah.
Um, but interestingly, it's focused on IgE mediated food allergies.
Hmm.
And since people have actually just started to utilize that study from 2015, when they're doing early introduction of foods, we're also seeing an uptake of
Hmm.
um, non IgE mediated food allergy like FPIEs, for
Yes.
instance, where
Hmm.
there's an increase in, I think they've seen peanut and egg,
Hmm.
increase in FPIEs.
Yes.
But what's interesting is maybe not necessarily changing what we're talking about for IgE mediated food allergies, but also realizing, when we are doing introduction of foods, there's not just one thing we're trying to prevent, but which is IgE mediated. There are other things though that we need to keep in mind and also potentially prevent
Hmm.
and do further research in,
Hmm.
namely microbiome,
Yeah,
for instance, and
absolutely.
early gut health and what is happening to our
Absolutely.
infants in those first few days of life and
Hmm.
how critical those first few days of their life is,
Hmm.
what they're being exposed to. Um, and I think this is actually a really interesting and exciting area of research.
Hmm.
I actually have I recorded a podcast on FPIEs that hasn't been published yet, and I don't even know if it's what sequence it will be with this, but talking about some of those issues. And this is an emerging group that I think we need to pay attention to. I
Hmm.
think more research needs to be done so that we can start getting them a better menu of treatment
Yeah,
options.
absolutely. I think that this is a very important conversation because
Yeah.
a few years ago, I'm going to throw my husband under the bus, but like just and patients that come to us and generally, generically, like definitions is such a pet peeve of mine, right? Like understanding what is IgE, what is an immune reaction versus what are these non-immune reaction kind of foods and the experiences. But like irritable bowel syndrome, IBS, and a lot of people that have food intolerances associated with it that think that they're allergic to those foods and come asking for your food allergy test in your
Yeah.
clinic. And I was just seeing so much of that during the pandemic. So I started actually, I wasn't finding answers in our field. So I actually went to the GI field to see how did
Yeah.
they approach this. And it's so fascinating to
Mhm.
kind of like look at your specialty from the lens of someone else peeking in, knowing
Yeah.
what you know, and then realizing how much they misunderstand with all due respect, because they're
Right.
not in it every day, but also to just there's so much overlap with our field and other specialties out there. And the gut microbiome is fascinating. We've just barely scratched the surface. But I talk about this all the time about the 30 to 100 trillion bugs in our gut and how any number of factors can just change that dynamic. And it doesn't mean that it's lost forever, it just means
Right.
that it's been disturbed. And
Yeah.
now we're in a new ecosystem. Like we are all walking rainforests. Like, isn't that crazy?
I
And cool.
know. It is cool. Yeah, we're like the Great Barrier Reef.
Yeah.
Um,
Protect it. Protect your gut.
yeah, it's interesting you say that in terms of getting into different specialty literature to understand, because I feel like our specialty is very much behind
Hmm.
in a lot of topics,
Do
namely
too.
microbiome,
Yeah.
long COVID,
Agreed. Agreed.
neuroinflammation. We're very,
Yes.
very behind. And those are things that I have actually had to go into different specialty literature over the last 5 to 10 years
Hmm.
to really understand better, because there are other specialties that are ahead of us,
Hmm.
with microbiome research, neuroinflammation research, vitamin D research.
Oh,
We are
totally.
so behind.
Absolutely.
Our
Well,
uh,
women's
Candidly,
hormones. Can I throw that
our,
out there?
our specialty gets it completely wrong,
Oh my
and I will be
gosh.
very candid with that. And people are like, "Oh, well," and they'll argue with me, and I'm like, "Try looking at other specialties literature and how they view that, and the studies that are done, and the parameters they're looking at."
Hmm.
So I think it's important that we are able to have these conversations and also get out of our narrow mindedness to
Correct.
view things from, hold on. And maybe there's a parallel in terms of our current climate and culture of maybe we need to be more understanding and less judgmental, but understand how people are viewing things from different lenses,
Yeah.
before we cast kind of the finger of judgment. So,
Yeah.
yeah,
Agreed.
cool.
That's that's really important. More. We need more research.
We do. More research is needed. Yeah.
Every article
Um,
says that.
it does. It's kind of that mandatory ending piece.
Yeah.
Um,
Just
well,
means that
Manisha,
we're
it's been,
never done.
what's
Yeah.
that?
I said it just means that we're never done.
Well, I think that's an important part of science
Absolutely.
is
Yes.
realizing you're not done, and realizing that, you don't have to be the know-it-all, end-all, be-all. It's no, I always look at it as, what am I going to pivot to next?
Hmm.
And what are those things that I just need to continue to learn and understand so that I can change
Yeah.
and constantly evolve and adapt as information comes out.
It's what
But
you want from any doctor and your doctor,
yeah.
honestly.
Well, it's been awesome talking to you today. I want to close with, we've listed a few of like your top challenges or top,
Yes.
mistakes that you see. This podcast is called The Immune Edit, and we always like to leave with a couple of edits. What are maybe your Dr. Rellan's top 2 or 3 edits that people can make moving forward,
Hmm.
given this challenges, the misinformation, mistakes, or whatever? What are things, 2 or 3 edits that we can make, or pearls, if you will,
Yeah.
moving forward to make the journey uh, a little more peaceful and grounded as we go
Yes.
through it? Getting back
Okay.
to your
Yes,
opening
I love it. I love it. I think one big one is follow your gut. So if you're in an
microbiome.
interaction, Your microbiome talks to you. Listen to it. It's talking. It's talking right now. But listen to it. You're in a visit with somebody, right? You're in a visit with your provider. You're having a conversation. If you feel like it's not going in the right, like you're not getting heard, it's not going in the right direction, your questions aren't getting answered, listen to your gut. It's okay to say, this relationship is not working out for me. And it's completely okay to say, I need a second opinion, a third opinion, a ninth opinion, like whatever it is, with whomever it is. I always tell people, believe in yourself. That was a theme from yesterday's Super Bowl
Yeah.
halftime show.
Right.
Believe in
Right.
yourself. Listen to
Yeah.
yourself. Listen to your gut that's talking to you, is one. And also, what the second is that we don't know everything. So have some compassion, have some forgiveness for your providers, that we are all humans treating humans. I come with me and my bag, and I told you that I treated a family with my perspective, which was to treat them as my family, but they didn't want that. And
Yeah.
that was such an amazing lesson. It hurt my heart because of the way it was taught. But I think that that was a great takeaway to have, that like we all are in this together. And when we communicate, that is when we can spread good messages throughout the world and together. So, third is check your sources. That's it. Misinformation, like
And
we
who's
said.
funding the sources?
Well, you can always follow the money. It's a good sniff test.
I would say check your sources, but part
Mhm.
of checking the sources, part B of checking sources, is who's funding it. So
Mm. It's always good to be clear
yeah, and transparent.
and
So
transparent.
well, thank you so much. It's been a joy to have you on.
Thank
Your
you.
platform's amazing. Your community's amazing. Just love all the engagement. Love the work you're putting out.
Thank
Great
you so
job
much.
on the book, and wish you all the best.
Thank you. Thanks so much for
Yeah.
having me.
Thank you so much again for tuning in. We'll see you next time on The Immune Edit. This show is separate from my clinical practice at Global Allergy Immune Network. This show represents my opinions and my guests' opinions. Neither myself nor the show endorses the views or statements of my guests. This show is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional. This show is provided with the understanding that it does not constitute medical or other professional advice or services. If you're looking for help in your journey, please seek out a qualified medical practitioner. It's important to have someone in your corner who is a trained and licensed healthcare practitioner who can help you make changes, especially when it comes to your health.